think what resorption is. Tooth resorption is the breakdown or destruction in sequence loss of the root structure of the tooth. It's caused by living body cells attacking part of the tooth. Couple important information is that it's caused by living body cells. So it is not done by bacteria, it is not done by some viruses, whatever. It is done by our body cells, and our living body cells. So it's not something like necrosis, but this is pretty important because you will see in the next pages what exactly is going on. Classification. First of all, we have to think about physiologic and pathologic resorption, and after all, internal and external. My question, because I like to talk during the lecture a bit, do you know situation where physiological resorption exists?
Is that when you have braces?
No, it's not physiological. It is pathological because nobody wants it. Neither patient, neither orthodontic doctor. I know it can happen, resorption during the orthodontic treatment, but no, it's not physiological. Try to find. There is no wrong answer, so don't worry if even you say something bad or stupid. For sure, you won't be punished in any way. So think, maybe you'll find something physiological. So something that is normal and accepted by everyone.
Could be like when we have milk tea and then it's the root of the milk tea get up reabsorption and then.
Perfect. Yeah, this is the only physiological. In any other resorptions of the tooth, of course, sometimes we know that it could happen. Sometimes we afraid it could happen. Sometimes we are prepared that in such way of treatment, resorption can happen, but everything of that is pathological. Proper resorption, as you know, that's the only physiological resorption is connected with the milk. Sometimes we are not, we forget about it because such a milk teeth as you can see here, this is normal teeth children love. But sometimes we forget that those roots looks like that a couple years ago. If you put some for example, maybe it's not the easiest to paint by the mouse, but something like this. Yeah, this is of canine, sometimes it could be even longer. It looked like this when patient was 3-5 years old. When he lost the teeth, the tooth are the roots are much shorter. So how it happened? You had the answer before. It is done by alive body cells. They are destroying layer by layer the root. Of course, because of our growing up, they have to be removed because permanent dentition is wrong. So this is the only physiological resorption of teeth. I don't want to talk about because term resorption sometimes could be using to the bone, to the other hard tissues, but today we are talking only about teeth. So physiological resorption about the teeth is only physiological resorption of milk teeth. So let's go to the pathological. In pathological, we have to talk about internal and external results. Internal, so it will start inside the tooth. How it's possible that the tooth is get destroyed? internal resorption. Let's start internal resorption type A. Type A is resorption. Maybe I will show you more or less how the root, more or less the canal looked like this before, and after it, it is the chamber is enlarged. So here is resorption. What's going on? We can say that the chamber is growing up. Of course, it's not normal situation, but before resorption start, chamber was much smaller. As you know, during ages, chamber usually reduced the size, but in resorption, something happened. The chamber is bigger. How it's possible? How it is done? We are coming back to the definition. It is done by alive body cells. So when you see resorption, internal resorption, it means that tooth is alive. If it will be pulp necrosis, resorption cannot be done. Resorption is done by alive body cells. Why resorption started? Unfortunately, we don't know the one proper answer. Sometimes said it's something connected with some antigens, the other thing about some inflammation. Unfortunately, we don't know. By the way, we know what to do if such a resorption happens. But let's come back to classification. Type A, it's called pink tooth. If you see the picture, you can easily say why the pink tooth it is. Why it's pink? Pink is because chamber is bigger and bigger, and pink pulp starting to be visible. Maybe you had situation that you got pretty deep caries that you can see the pulp through the dentin. Maybe some of you had such a treatment. So you can see that the pulp color is red or pink. In this case, you haven't got caries, but you've got a really small distance between pulp and bottom of our, let's say, cavity. I haven't got cavity, but between the surface of the enamel. That's why we can see. Next situation, the same. Pink tooth, you can see the color of this upper incisor because pulp is visible, blood vessels are visible. Type B. Type B, it's a situation when you've got the same resorption, but not in the coronal part, but in the radicular part. So we've got, once again, alive body cells that destroy hard tissue. By the way, I forgot to tell you at the beginning, if you got any question, please interrupt me, because I prefer to get some questions from you immediately, not to wait to the end of the lecture and then probably we forgot about it and there's no sense. So if you got any question, go ahead, start to ask me and tell them. Internal resorption, so type B in the radicular part. Type C, the most difficult to treat, because this is a situation when the resorption are connecting between the pulp and periodontal tissue. How to treat internal resorption? Once again, let's come back to the definition. Resorption is made by alive body cells. So if you remove alive body cells, resorption is done. It's not possible to, to change back the resorption, so to come back to the previous situation. Unfortunately, We still don't know how to do it. But if you do endodontic treatment, remove all alive tissue, the resorption process stops. How to do it? We have to destroy all alive tissue. That's why we use the highest concentration of the hypohyaluron. We can use ultrasound irrigation. You should use intracanal medicament. And we should use thermal gutta-percha operation. Why? Let's come back to the situation. Type C is the most difficult and usual. The tooth must be extracted because we cannot fill the canal very well with the hot gutta-percha and not destroy the periodontitis. That's why in such case, unfortunately, treatment is pretty difficult. But let's come back to the internal resorption type. As you remember, endodontic treatment, we have to open the chamber, and luckily all the resorption we put here. So what to do? We have to just enlarge properly the chamber and resorption, remove it. Remove it by the excavator, remove it by the burr, then use hypohyaluron to destroy all alive part. We can put calcium hydroxide medicament and fill the canal. To diagnose and to treat resorption type A is pretty easy. Much more difficult is type B, because we can easily open the chamber, but how to treat this region? That's why we use all those devices. If you will using the traditional way of treatment, endodontic treatment, you will clean more or less this area. What we can do to clean the other? The other option is to use step back or crawl down technique to enlarge. But of course, it's not possible to enlarge such a thing because you will destroy all the tooth. That's why you have to think about something else. We are using highest concentration of hypohyaluron, using ultrasounds. Why? Just to clean this area that cannot be taken by the instrument. It cannot destroy it by the burr. We have to use hypohyaluron and ultrasound just to mix the hypohyaluron to these layers. Moreover, we put calcium hydroxide dressing medicament to put to this, and we keep it for a couple of weeks. Then we can almost be sure that all alive tissue were destroyed. And we have to, once again, put thermal obturation. Why? Because if you use traditional gutta-percha coins, gutta-percha cone, we will fill this red area only. The lateral part could be filled by sealer only, or will stay empty. If you use thermal technique, we can use layer by layer and obturate this area. Okay. Once again, internal resorption only pathologic. It's because the reason is some alive body cells in pulp chamber or in pulp canal. We have to remove it using high concentration hypohyaluron, ultrasound irrigation, calcium hydroxide medicament, and hot gutta-percha obturation. Let's go to the next step, like external resorption. By the way, you've got the orthodontic treatment. What are the reasons? Here it's easier because we know some of the reasons. Chronic apical periodontitis, trauma, improper orthodontic treatment, tooth bleaching. Classification of external resorption is not so easy like internal, but let's try to go step by step. External surface resorption, external infection-related resorption, external trauma-related resorption, external spontaneous ankylosing resorption, external multiple site ankylosis, cervical imbalance resorption. Let's try to external infection-related resorption. I think the most common. So we've got, as you can see on the picture, so you've got the situation that there is some infection, and those infection is connected to the tooth. We've got some kind of cyst, or we've got some kind of abscess, and the tissue, body cells that are in the layer of it, destroying everything around. And they can destroy as well the root, so they can do resorption of the root. Next aspect is cervical invasive resorption. Very unlucky thing because we don't know exactly the reason of it, and it could be pretty dangerous situation that sometimes even tooth must be extracted. Here you can see the situation, how it looks like. Surface resorption, so layer by the layer of the tooth. Apical inflammatory resorption. Replacement resorption, ankylosis. So instead of the tooth, instead of the periodontal tissue, we've got a bone. There are two problems in this case, because we should know, and it's difficult to keep this tooth, but it's difficult to extract it as well, because it's joined with the bone. And here we've got some idea how to clean, how to treat layer by layer. Here the resorption, endodontic treatment, and obturation. In the first part, we obturate the apical part, central part, and finally all tooth obturate. Necessary to be sure where the resorption is located, we should take 2 X-rays, because maybe I will paint close to here. The first X-ray could be like this, and from the other angle it looks the same, or you will see something like this. And so we should know that, or maybe the other. No, sorry, once again. Let's imagine that you can see X-ray of the first one, and you are afraid endodontic, it's internal resorption. If you take from the other angle, it can look the same. Then you are sure it's internal resorption, or it can look like this. And then you know it's external resorption. Before I summarize the lecture, maybe you've got some questions to this part.
I have a question. When you explained surface and apical, could you go back to that slide? Like, did you have pictures?
Unfortunately, I haven't got pictures to them because, unfortunately, external resorption is very difficult to recognize. Even the classification, I'll come back to classification, many doctors try to classify it, but it's not so easy to classify it like internal resorption. Moreover, even if you got some example, sometimes it's difficult to classify it, exactly what kind of resorption it is. Is it really infection related or is surface resorption? That's why I give you those, but well, during clinical aspects, nobody's interested exactly what kind of resorption it is. Sometimes the only thing we are rather try to think what is the reason of resorption. So if it's improper, it's inflammation, we have to do endodontic treatment. We have to, I don't know, do the scaling or root planing, something like that. If it's trauma, we try to, I don't know, stabilize it to avoid. If it's improper orthodontic treatment, maybe it's a good idea to stop orthodontic treatment or to reduce the forces of the brace. So that's the more important. To be sure, even in different books or in different, it's very difficult to give you examples of all those classification of external resorption. That's why in my lecture, yes, I try to find the best pictures of infection. It's easy. Cervical, yeah, because it's, but all the other, it's very difficult. Maybe ankylosis, yeah, but inflammatory or surface even I haven't found such a good picture to show it. So yeah, it's pretty difficult to find it.
Thank you. And then I have one question not related to this. Could you email me the topics for the semester so we know how to prepare for the final?
Okay, no problem.
Okay,
No problem. I will find. I will give you all the topics of the lectures and topic of the classes. Yeah, no problem.